My name's Devin Henderson, and I'm going to be the OT for Mike, 29-year-old Mike. And some things that I'm going to be talking about are going to be precautions. So if he's wearing any type of splints or undergarments, we're going to want to watch for infections. Mike needs to look out for redness, any type of redness on his skin, swelling, any type of drainage that has a smell to it or a pus color to it. That could indicate some type of infection for Mike. We're also going to want to instruct Mike on the movement of his arms, legs, everything, all of his joints, because he can get calcium deposits built up in his joints. So if he's having a hard time moving his joints back and forth, that's something we need to instruct him on. We're also going to look for nerve injury sensation from the pressure garments and possible splint use. So if Mike can't feel his fingers or his hand or something like that, that could be from the pressure garments being too tight or the splint pushing down on a nerve. We also want to talk to Mike about scar massage. There is a thing called hypertrophic scarring, and that's a painful, itchy scar. It builds up collagen, and there is blood and nerves to this area. So we want to make sure he follows his scar massage protocol, and that he's getting that done in his therapy, and if he has any home indications for that. Next, we're going to want to talk about the care of the splint. So if Mike takes his splint off, we want to make sure that the pressure garments don't become dirty. If they do, they either need to be washed or replaced. The splint can accumulate dirt and microorganisms, so every time he takes the splint off at night or whenever he's not wearing it, he needs to clean it with a disinfecting agent. And like I said, he wants to do a skin check and watch for skin breakdown, any type of failure of his skin grafts, and any type of pressure ulcers or ulcers on his skin. And that can be indicated by redness, swelling, itching, things like that. Now, Heber talked about adaptive technology with self-care, and I'll hit that again. We want the built-up handles for feeding and eating, long utensils for energy endurance. He can use two hands when he's moving stuff. Instead of using one hand to move something, he can use two hands for energy endurance. For bathing and things like that, we want to have the raised tub shower chair. For energy endurance, since he can't stand for that long, we want to have the raised toilet seat, which will help him maneuver for toileting. Some other things we talked about are an electric toothbrush and an electric toothpaste dispenser, as well as electric dispensers for his shampoo and lotion and things like that. If he does a lot of writing and things like that, we want to use built-up pen and pencil grips for writing. Another thing we could look at if Mike wants to get back to driving is hand controls for his vehicles. If that's what he needs, that's something we can look at. Another thing we talked about is using power tools at work. Instead of using manual tools, use a power-driven socket instead of a manual socket. If he's having trouble putting on his shoes or tying his shoes, losing endurance, we want to use Velcro shoes. We want to have him park close when he's going into places, going grocery shopping, things like that, so he doesn't have so far to walk. We also want to talk about ergonomics. If he's using the computer, can he use a swivel keyboard, one that sits higher? We want to have him have those ergonomics available. For leisure, me and Heber talked about IDing his interests and his social participation. So we know there's going to be a portion of psychosocial in there that he doesn't feel comfortable going out. Hopefully with his support groups and things like that, he's going to get more comfortable. We want him to stay with his close friends, the circle of support that he has right now. We talked about having him go to snowmobile races with friends, watching snowmobile races and snowcross television shows and videos, things like that. For his car racing interest, we can have him watch NASCAR on TV. We can have him keep going to the amateur races with his friends, maybe showing his face around and letting know people that he's all right and that he's going to be coming back to racing. That will increase his participation and increase his self-esteem. Just several different things that he could do for leisure, but like I said, we have to ID those and make sure we can find out what he wants. So for possible occupations, I know Heber talked about job accommodation network. We're going to go in with him to his job and find out exactly what he needs to perform his job, essentially. We want him to try to return to work part-time, and that's what he wants. So we're going to collaborate with him to make that goal happen. We were also thinking that he could teach part-time as a mechanic at the college level, just depending on his wants and desires for that, and he's knowledgeable in that area. So we went over a lot of things with Mike, and we know that psychosocial is going to be a big component. Like I said, keeping his support system and his friends and family, and just keeping staying in groups and getting out there will help him in the psychosocial aspect. And I think that's it. Just hit that red button.